Hello, good evening, fellow Kenyans. My name is Fred Ouma. I'm a project development and management specialist. I also advocate for human security. Human security involves achievement of three main indicators. One is freedom from fear. Another one is freedom from want. Then the third one is upholding human dignity. So that's what I do. Um, I've been following the COVID-19 situation in Kenya with lots of interest. Of course, because this is my home. And secondly, because I've been lucky to manage projects during periods of outbreaks and being a programs manager then in projects in Somalia and northern Kenya. I had to make decisions on behalf of the program and respond to. There's a time when we had two disease outbreaks, cholera and chikungunya. 23 out of 25 staff that were working with me were down. Yeah, and we managed to do it. So I share what I share basically also comes from my experience and what I know in terms of my professional line of work. So first and foremost, I want to say that disease outbreaks are very, very hard to forecast, both in magnitude and spread patterns, because they are an enemy you don't see coming, even with the best surveillance systems. We see what's happening in Europe, see what's happening in America. Many things can be said, but with their capability, it's a challenge knowing what to do because it's an enemy that you don't see. It's not like a thug or anyone that you can see. So without going into the older coolers of what the government should have done, I just want to say that I commend the government for what they've done so far. You can only do so much and according to your capability. And so I'm here to propose a way forward in tackling this pandemic. So let's first look at what are our needs. What are the needs that hinder effective response to the COVID-19 in Kenya? I think number one, the greatest need is the need for accurate data that will inform all efforts on tracing, mapping, and isolation or treatment of active cases. Yeah, so the first need is need for data, accurate data. Yeah, for tracing, mapping, isolation, treatment of the active cases. Then number two, the second need is for local capacity at the grassroots level. And by grassroots, I mean community levels at rural and slum areas, places that may be the weak link in this fight. So we need local capacity built in those places to enable prevention, detection, isolation, treatment, and referral of cases. Then thirdly, we need to look at the issue of stigma. There's already stigma against COVID-19. There was a woman who committed suicide the other day. I think she was a foreigner, South African or something, and she was found in Kenya and told that she was COVID-19 positive. She committed suicide. That's stigma. It's just stigma, and we've seen there are many cases on that. And then fourth, we need to enhance the intra and inter-community level stakeholder collaboration and coordination. We need stakeholders at the community levels to come together, to be well coordinated and collaborate. So what steps should be taken to address these needs? Number one, the community level alert and response mechanisms must be activated ASAP. What do we mean by this? This can be achieved by enlisting the services of community health workers and whom we refer to as the CHWs and the community health volunteers, the CHVs, to support the community level services. Remember, the first need was the need for accurate data. These people can be trained and equipped through provision of safety attire, as well as smartphones. And these smartphones will be used to collect data at the community level, at the grassroots level, where these people will go to households and they'll be trained on clinical diagnosis of this disease. And then when exhibiting signs of the COVID-19 illness, They'll be able to take the data, map the houses, and send the data on an online platform. We have many of such platforms. We'll just use any of them. And these platforms will generate data in terms of presentations, graphical presentations, and maps, so that immediately the data is presented, support teams in Nairobi or county headquarters will see these and know where to deploy their personnel and resources to efficiently respond to high-risk areas. Secondly, the local resource persons, namely the CHWs and CHVs, leaders, that is political, religious, and Nyumba Kumi leaders, should be trained and equipped with the following. A, sensitization material that include charts and pictures, which will be used to sensitize the local communities at household level. These people can move house to house and talk to people about COVID, about prevention and all that. And then secondly, because remember, behavior change is key to controlling the spread of any disease, actually, most communicable diseases. And then B, they need to be equipped with the DIY or do-it-yourself manuals that train local communities how to produce homemade masks, soap, hand washing apparatus. Now, there's discussions about homemade masks. Let me tell you, as much as they're not 100% effective, but they are better than nothing, and they are good for the poor, the majority poor, because they prevent infection from me to you and you to me, not the other way around. So homemade masks should be encouraged, and these people, the community resource persons, that is the CHWs, CHVs, the leaders, that is the political, religious, and Nyumba Kumi, should carry these manuals with them, very simple manuals that train the communities how to produce these masks, soap, and hand washing apparatus, that is the hand washing doors and those things. And then third, they must be given mapping and case reporting templates, tools, and devices. We've already looked at the smartphones as one of these devices. They can have a small form where they collect this data, and then they can be taught how to map the households. And of course, because they come from the local areas, this should not be a very difficult thing. Then thirdly, we need to involve community leadership and structures in the processes of identifying households as well as community level isolation mechanisms of active cases. You know, as it happens right now, we cannot depend on the existing health facilities alone as isolation centers, because they'll be overloaded, of course. So our approach here is that we must train the households how to isolate in case a member exhibits these signs of COVID-19, how to isolate within the household but still be able to provide for them in terms of how to give them food, how to get them the care that they need before the next level of isolation sets in, where they report, and then there are isolation centers at the community level. And this could involve social halls, community social halls, schools, because schools are closed right now, fields where tents can be put up by other stakeholders like Red Cross, etc. So that's the third thing that should be done. And then, of course, with these we have the people trained on clinical diagnosis, that are looking at people and who exhibit certain signs and dealing with it. Of course, it's not accurate, but it's a starting point to eliminate the spread of the disease. And then fourth, we need to train community leadership that we've described above on resource mobilization. Remember, the resources are never enough, and we cannot wait for the government to come and give us money and food. What we need to do is to train the leaders to be able to raise the resources that they need locally. How can they do this? They can lodge appeals to their community members, to churches, church members, and during their visits and the sensitization session, and say, if you have an extra maybe bag of food, donate it. We can distribute to other people can't afford. You see? So we are saying that we need to train these people on resource mobilization, and above that, we need to train them on resource utilization, so that when the resources are found, they can be utilized properly. And then the government should also step in and enlist the services of consultants, a few of them, to guide in the technical coordination of activities, of course. And then fifth, we need to engage existing human resources at the community level. And these are professionals who include health practitioners, engineers, social workers, etc., to volunteer their services in the ongoing response process. Yeah, if you're at home, you are caught up at home, and you're a retired doctor, or maybe not even retired, maybe you're just a doctor, you're an engineer, you can help with the development of solutions, maybe the hand washing apparatus. You're a social worker who can mobilize, who can train, lend your services if possible, of course with lots of care taken and adherence to the government regulations. Yeah, so, and then sixth, we need the national and county governments to give tax breaks and other incentives to enable local business communities to support local response systems. As you said earlier, the community should be able to raise resources amongst themselves, even at a very small level, micro level, so that when they go to the macro level, they have something to work with. Yeah, we don't want to wait for the government. The serikali saidia mentality. That's what you're trying to defeat with these approaches. So we're saying that, on the other hand, the national government and the county government should respond and give incentives to the business community that wants to support their local communities. And then, all in all, if you look carefully, what you're trying to say is that there's need to move all response initiatives to the grassroots. And by grassroots, I mean the villages, the rural settings, and the slum areas. So that, because these are these are areas that could be the weak link in the fight against this virus. So we say that we need to improve the resilience of the local communities towards this pandemic. So last but not least, as a human security advocate, I want to say that in whatever we do, with regard to responding to COVID-19, let us ensure that we uphold freedom from fear. Yeah. And then secondly, we want to uphold freedom from want. We don't want people to be desperate. We don't want them to go hungry, right? We need to come up with micro and macro solutions to these. And then finally, we need to uphold human dignity. Whatever we do, we must never trample on human dignity. Yeah. And with that one, I say stay safe. Thank you. These are mini advices that they're actionable as projects, and I'm available and I believe there are many other professionals who are available to guide in the implementation of these things that I've just said. So just a small rundown to it. We say that we need accurate data, and we say that you can get this through the community health workers, community health volunteers. We say there's need for local capacity at grassroots to enable prevention, detection, isolation, treatment, and referral of cases. We said we need to deal with the issue of stigma through trainings and sensitization. We said we want to enhance inter community level stakeholder collaboration. And that's all for now. Thank you very much. Stay safe.